MPNs are quite a rare group of patients. The numbers of patients are small, and as such, maybe they haven't received the amount of attention that other different cancer groups have in terms of cardiotoxicity. However, with the different types of MPN, we know that there is an increased risk of thrombosis, there's an increased risk of cardiovascular events due to that. The risk scoring mechanisms that we have, unfortunately, cannot take into account the added risk that MPN patients have. And often what we find is if you risk score them using traditional cardiovascular risk tools, you will be grossly underestimating the risk of a cardiac event. So what we propose in our paper is to try and modify that risk scoring algorithm, taking MPN as a risk factor into this, and potentially trying to more aggressively risk modify, looking at the traditional risk factors, but maybe trying to get more on top of these, not just via their primary care physician or not just via their cardiologist, but asking the hematologists, the oncologists themselves to try and help suppress elevated blood pressure, diabetic control, to greatly decrease the overall cardiovascular risks. I think that was one of the key messages that we sought to bring out in that paper.